Hello, and a very warm welcome back to the EMJ GOLD podcast, brought to you by EMJ, your number one open access destination for HCPs and pharma globally. We're officially back for a new season. It's great to be back in the studio with you, Jade. How's it going?
Really well. How have you been?
I've been really good, very much looking forward to what we have coming up. Could you give our listeners a bit of a taste?
Absolutely. Well, we've got plenty on the horizon. We're going to be meeting with senior leaders from the world of allergy care, mental health, commercial strategy, all of this and beyond in the upcoming season. And we're going to be discussing a whole range of really interesting topics, I think, with some key players from the industry. I know personally, I'm very excited to share them all with you.
Me too. And with that, how about we get into the season? So today we're going to be kicking off with a really great episode. And Jade, I'd love it if you could tell a little bit more about our guest.
Well, I recently had the pleasure of sitting down for a chat with Chantal Friebertshäuser, who's the Senior Vice President and General Manager of Commercial for the EMEAC region at Moderna. It was great to chat with her. We talked about a whole host of things. She's been with the company since 2023, actually, and she is responsible for spearheading their commercial initiatives across the diverse markets that she is overseeing, driving the company's growth and expansion in that EMEAC region I mentioned.
That's right. Our guest has an impressive 25 years of experience in the pharmaceutical industry, having previously worked at MSD as a Senior Vice President and Managing Director, and a 10-year stint at Eli Lilly. She is currently based in the pharma hub of Switzerland, so she joined us virtually for this interview, I believe.
She did. Her background's great as well. It's very ethereal. It's wonderful.
Great.
Yeah, it was a great conversation with her. I really thoroughly enjoyed it. And we spoke about the burden of vaccine hesitancy in Europe in particular, but also what she thinks has led to the erosion of trust in vaccines. Ways to navigate misinformation around that. That's a big topic, I know it always is, and much more. But I do think that's enough from us from now. Shall we listen in?
Let's do it.
Good morning, Chantal. How are you doing?
Doing very well. Thank you for having me.
Do you want to tell our audience a little bit about you and what you do at Moderna before we get into it?
Yes, with pleasure. I'm the lead for Europe, the Middle East, Australia, and Canada at Moderna, which means building operations in part of the world in order to make sure that people have access to our groundbreaking vaccines and medicines in the future.
Definitely. It's such an important role and something that we're going to be discussing today. I know you're very interested in the role of vaccine confidence and what that has to play in global health. And I know from discussions before that in the European region alone has one of the lowest levels of confidence in vaccination. And that's something that I want to chat to you about today, and why you think ultimately this erosion of trust has happened in regions such as Europe specifically.
Yeah, it's quite impressive to see. Actually, the United Nations are very clear in saying that after clean water, vaccination is the most effective public health intervention in the world for saving lives. And there is recent report also showing that during the pandemic, because and through the introduction of COVID vaccines, 1.6 million lives could be saved. And nevertheless, you see an erosion in vaccination. For instance, in COVID, since the pandemic, the vaccination coverage has been going down, although we know that regular vaccination, revaccination is so important. We also saw during the pandemic actually a drop of vaccination for pediatric vaccines, so for children, by 30%. And the goals from WHO to reach 75% vaccination coverage rate for the recommended vaccines is rarely met in Europe. There are only a couple of countries who meet that for some vaccines. So there is definitely a big gap between what is known, what could be done, what should be done, and what is actually implemented. And part of that, that's not the only reason, but part of that reason is definitely vaccines confidence that has history, right? It's not from today or from yesterday, and maybe it's exacerbated by the pandemic effect, and maybe the topic that has been politicized. But at the end, it is something which is very known and well documented for ages. And actually, since the introduction of vaccines, there were misleading interpretation on what it could be, and conspiracy and all of that, creating this kind of gap in confidence, as one example.
Yeah, I definitely agree with you there. I think there's always going to be sort of pockets of people that lead into misinformation. And obviously, we saw during the pandemic the swathes of misinformation online, sometimes led by public figures, important figures in the US. And yeah, just seeing the how easily that was spread and led to those decreased vaccination rates, it was quite surprising. So, do you think there are specific demographic groups necessarily that Moderna has identified as being more hesitant when it comes to vaccines?
Yes, there is actually insights around that. There is actually a report named State of Vaccine Confidence in the European Union that relates to that. And indeed, they are demographic and cultural and geographical factors that affect that. And just to name two of them, age is one. So it seems like younger age groups tend to have lower vaccine confidence compared to older age groups. There are some interpretations to that. So some say, well, younger age people didn't see anymore the impacts of some diseases because in the best vaccination rate that we have in most of the European countries is in infants, and because of that you don't see anymore so many polio cases, for instance, as my parents used to see, because it was before vaccination existed. And then another example is geographical and cultural factors. You have very different confidence rates in different countries, even within Europe, which is very interesting. So you have a very steep decline, for instance, in confidence in Eastern Europe and in Central Europe, and the Baltics and the Netherlands. So there is a big difference. For instance, if you look at countries like Portugal and Spain, who tend to have the highest confidence in vaccines, and big discrepancy to, for instance, Slovakia and Latvia, who are on the lowest range when it comes to confidence in vaccines.
Oh, that's really interesting. I think from conferences I've attended as well, it seems as though confidence in vaccines also relates to sort of healthcare as a whole being harder to access as well. So I suppose if you're not even seeing it, not necessarily at a young age, but even just in older life, if people that you know aren't able to get vaccinated either, then you think, oh, I don't need it because everyone else has survived until now. But then, as you mentioned, yeah, we have rising rates of measles coming back. One of the people I went to school with got measles in her first year of university because she'd never been vaccinated. And it's just, you don't expect these things to happen in the day to day.
Well, that's a very good point. Indeed, access to care, I would say, to healthcare, doesn't mean only access to treatments or access to vaccination, but also means access to information and infrastructure that reinforces prevention or reinforces diagnosis and treatment. All of that contributes to better places, but there are also historical reasons. So I remember having discussed with somebody engaged in public health in Portugal, mentioning the history and how bad some epidemics have been in the past, and that made the country switch. And not only in terms of appreciation of vaccines, but also in putting the right infrastructure and information in place to make sure vaccination is established in a better way. So it's really multifaceted. Having the right access to information, having uh, uh, governmental affairs, a scientific community rallying behind one clear message, transparent one, but also making the infrastructure in place so that people get vaccinated. All of that coming together, this cohesion is extremely
Yeah,
important.
collaboration and cohesion are hugely key there. I think I agree. From your perspective, do you think there's more that the pharmaceutical industry as a whole can do to improve vaccination education on that side and combat those effects of misinformation that we mentioned earlier?
Absolutely. And I would say I would start even one step before. So before education come the development, come research and development. And we have a key role to play to make sure we are developing more vaccines. There is actually a minority of virus or diseases caused by viruses that can be addressed with vaccines. So there is much more to be done in the space of developing safe and efficacious vaccines to prevent against virus caused diseases and death. And that's where our job starts. So the more we have tools and demonstrate how much these tools help, the better it is. And then it's all about information transparency, transparency about the way we develop our products, transparency about the efficacy and the safety profiles, information about diseases as well as vaccines and this profile. But that alone will not be enough. So our role is also to collaborate with the right players in order to make sure it comes through, and it's coming through in a very credible way. But definitely we have a big role to play there, alone and in partnership.
Partnership seems to be a key topic that keeps popping up here. Do you think there's more of a role for companies like yourselves, I guess, to be more transparent in vaccine development processes, like you mentioned there? Do you think there's more of the science that can be shared with patients just to get them fully on board?
Yes, yes and no, because in a way, our industry has a very clear transparency codex that we are up to. And so we disclose the way our clinical trials and development is done in a very transparent way, and it has to be. And then on top of that, we decided very early that we are going to make our technology accessible for other researchers of the world so that they can develop for rare diseases and for rare virus infections. They can develop vaccines and therapeutics based on our platform. So that's also part of the transparency. So it's transparency about the way you develop your products. It's transparency about information on the vaccines, about the safety and efficacy profile, which I think our industry is very strong at, and we are very clearly attached to that and make sure it happens. But it's also making an open access to our platform so that other technologies or technologies can be further developed using our platform. I think that's really a role we can play and we want to play as Moderna.
Definitely, yeah, it's hugely commendable. I think the discovery of what mRNA can actually do for saving lives and advancing science for the whole world, it was really key. I know such big news. I wasn't working in pharma at the time during the pandemic, of course, when everyone started learning about mRNA. And I remember just finding it so amazing. I think that is something that really interested me in getting into the industry. So yeah, it's wonderful to see that Moderna did share the platform and that, you know, you're making it accessible for everyone. And I think I agree with you that that really helps in aiding public confidence in that. I think a lot of people, the pharmaceutical industry as a whole has had a bad rep. Of course, we're in media. There's everyone dramatizes things a lot, of course, and with Netflix shows that take hold of sort of the more toxic sides of the industry that have happened in the past. It's great to see public knowledge really gaining around the good things that the industry is doing.
That's essential, absolutely.
Cool, thank you for that. We've mentioned earlier about the role of governments, so I want to talk a bit more about that and what sort of policymakers there can do to help addressing vaccine hesitancy. Do you think there are some, first of all, what the role do you see the governments playing in this, and what opportunities and challenges for the public and private sectors to work together on this issue do you see?
Absolutely. Absolutely. Governments have a key role and they can't be alone on that. And why? The first thing is that it's all about public health. It's all about protecting lives. And protecting lives mean huge impact on individuals, obviously, but it also means impact on economy, on socioeconomics, on the ability of a country to be able to decrease costs and to increase productivity. So there are many aspects linked to social economics that are, and public health, of course, that comes with prevention and with vaccination by itself. So it starts with a high return on investment. Adult immunization programs can return up to 19 times the initial investment, and that's, of course, offering significant economic and societal benefits. It reduces, as I just mentioned, healthcare costs, increased productivity. Um, what it means is more years lived in good health allow individuals, for instance, to engage in work and in community in a better way. So what can be done? What does it mean? Well, a lot can be done by governments in increasing vaccines coverage rate by helping with infrastructure, by helping with information, by making sure there is a place where people get informed, people get vaccinated. And that's one of the key things, by the way, that has been studied very nicely, that yes, information is key, but having a key, knowing exactly what kind of vaccines you need or your family members need, and knowing exactly where you find it, or establishing a structure and infrastructure, be it at schools for children and adolescents, be it at work, or being in an immunization center, is key in order to drive confidence and to drive vaccination coverage rate. But it's also doing something against misinformation. So misinformation always happened. In the lives of social media, it's happening even more. And so putting also for that a clear framework, putting also clear policy in place, but also implementing pro-vaccines policy is important. And that's a key role for government. But that alone will not be enough, or governments alone cannot do the work themselves. They need, of course, healthcare players to work with them. They need the scientific community. They need the research and production and manufacturers of vaccines to make sure there is the right access to the right technologies at the right time in an affordable way for the relevant countries. And that's, we are committed to play our role in that wherever we can, providing access to the broadest population we can in the world.
Yeah, wholeheartedly agree with you there. You said so many good points. Yeah, it's interesting your point about establishing that infrastructure in schools, starting education like early on to make sure that children are on board with it. Of course, there's different demographics, as you say, that pass down sort of through family matters, that we don't get vaccinated, we don't do this, but it's good to, try and get the children involved and try and sort of think for themselves and let them know that you could be vaccinated against this. Here's the science behind it. Here's what you could do about it. And economics always comes back to economics, but I think, yeah, what you mentioned there about speaking in their language and helping them come to terms with, okay, it is for public health, but also this means that people are living longer and healthier and they get to work for longer, and it all trickles back into the economy. Governments are always going to come down to, I think, at the end of the day, the hard line is getting money back into the economy and making sure that they understand that in their own language, in a similar way that, marketing and medical affairs professionals, they have their own languages that they speak amongst themselves, and the government officials have their own languages that they speak. So translating things into their terms and helping them come to terms with that and understand it, I think that's a huge role that can be easily established there.
Yes, absolutely. And it's actually crazy if you think about what can be done and prevented through vaccination, and that everything is in place. Like in the majority of the countries in Europe, you have access to all recommended vaccines, or to the majority of the recommended vaccines. And nevertheless, it is not taken just because of misinformation in most of the cases. So yes, there is a big role to play for us as in a collaborative manner. I'm just coming back to this COVID example. I mean, COVID today in Europe is killing more people than flu. And still, the understanding is, well, I've been vaccinated so many times against COVID, I don't need it anymore. It's not a mistrust in the majority of the cases, it's a misinformation that repeating your vaccination because you adapted to the new variant of the virus will protect you, and particularly in vulnerable population, older adults, it's in most of the countries killing 3 times, even more in some countries, more than flu. And so just having this, and not talking about long COVID and the impact on younger population even, But just having these facts out there in a very simple way and clear way so that people understand why, the reason why it is so important. And it will only happen if we all in collaboration, right? So if we have the right scientific innovation, but in collaboration with government, scientific community, and then healthcare workers, make sure this information comes across and the infrastructure is in place.
Important. Well, I can't believe that statistic. It's wild. Was it 3 times more than flu it's killing?
Yeah, in most of the countries, in some even more.
Wow. God, that's quite shocking. Even so many years on from like the big boom in 2020 that it's still happening. But I think, yeah, I agree with you. I've heard myself as well with sort of older members of my family, oh, I've had so many vaccinations now, I don't need another one. Speaking of COVID, actually, we're seeing a bit of a summer wave on the rise at the moment. Are you seeing any specific forms of misinformation on the rise at the moment?
Yes, overarchingly, the misconception is that if you are already vaccinated once or twice against COVID, and or if you get infected by COVID, you don't need to be vaccinated. And the science is very clear, you need so. And it's very helpful to get vaccinated either to prevent diseases, hospitalization, deaths, and or to prevent long COVID. Now, putting in very easy terms, COVID in a way is now like flu. You need to regularly get your shot updated, particularly if you are part of the vulnerable population. Why? Because A, these vaccines are very efficacious in preventing diseases to happen. And B, because these viruses are evolving. And by that, you need to be always protected against the most prevalent virus type. And so we also talked about infrastructure, what can be done, what can be put in place by governments as well as healthcare workers. One of the quick wins will also be to add COVID to your flu shot. So whenever you go to your flu vaccination, having COVID at the same time would be a really quick win, and establish COVID prevention or COVID disease prevention as a very standard part of your prevention schedule.
Wow, you've brought me to my last question. Thank you for sticking with me so far. You've been amazing. I want to talk about a bit more about you and your leadership style here. As a leader, I've heard that you believe in breaking down barriers. And as we've heard during this conversation, you really believe in a culture of collaboration and how cooperation can lead to better results. Could you give us an example of why this philosophy is so important in today's vaccine landscape?
Mhm. I've seen that over and over and over again in my career. That if you rally an ambition, a vision, with bringing diversity of thinking, expertise, and enabling this diversity of expertise to be heard, just bring the best outcome. And the best examples where I've seen that in my career is in vaccines, actually, when it comes to outside. But it requires it's the same principles of leadership. If you collaborate with an external world as if you are the leader of a team, if you make that happen, that you look at one common ambition and you get all the different representation, then you can make things happen. And I've seen that in my prior life in like HPV vaccines and preventing cancer, and having people rallying behind an objective of eliminated HPV related cancer. And I want to see it again when it comes to adult respiratory vaccines. And what about we have a common goal of eliminating death caused by respiratory viruses in adults? We could make it happen if we rally as industry, government, scientific community, healthcare workers. We could make it happen. And we're talking about millions of people that can be protected by that. So yes, this principle of leadership has just been confirmed, and you see that over and over and over again. So I like to work with that, even if it's not always easy.
Of course. No, it's really encouraging to see as well the diversity of expertise and thinking, and that can really lead to huge changes in the industry, not even just inside of a company, but then in the things that the company is producing and helping the world with. Amazing. Well, thank you so much for joining me today, Chantal. It's been wonderful to have you on.
Well, look, I found that interview really interesting. I think Chantal shared some pretty interesting insights and some pretty shocking statistics there as well. I was really shocked to discover that COVID still kills 3 times more people than flu in some countries. And I agree definitely with what you were both talking about in terms of vaccine fatigue. I think it's so important for people to stay informed and to support those initiatives that are pushing for greater vaccines and, revaccination as well.
Yeah, absolutely. I couldn't agree more. And again, it was so great to chat with Chantal. I think personally, I really enjoyed her points about the role that governments can play in addressing vaccine hesitancy. I think a lot of the burden can be felt by pharmaceutical industry, but there is also a role of governments in helping populations grow healthier. Speaking another person's or function's language as well can really help people understand how those certain initiatives will ultimately benefit them in the long run, as we mentioned, and in this case can really contribute to better health for all. So hopefully that's something we do see in the future.
Absolutely. A great start to the season. However, that does bring us to the end of today's episode. A big thank you to Chantal for joining us, and thank you to you for listening. I know we're both really looking forward to season 8. We've got some great guests lined up, and we can't wait to share their stories with you.
Absolutely. Do be sure to subscribe so you don't miss out on our next episode. But until then, it's goodbye from us.
Bye for now.